Welcome back, everybody, to the Bulletproof series. We are going over the bulletproofing the basketball player today. It's going to be an incredibly exciting podcast because we're going to talk in bunches on what kinds of injuries that basketball players get into. We're going to touch briefly on LeBron and Kobe's recovery and other things that we need to do to make sure that we prevent injury as a basketball player, but not only that, what to do to get to that next step, higher level amount of effort. I am Dr. Addy.
And I am Dr. Jace. So, much like Doc said, we're going to dive into all these other fun specifics, like he said, in terms of injuries, in terms of what are the higher end level athletes doing, how are they maintaining their body, and then at the end, we're also going to go over some skill development, things that you may not be aware of to improve your game moving forward. But I think it's best to start with what injuries have you had, and to overcome those to improve your longevity so you stay healthy is probably the best way to start. Because if you look at any high-end level athlete, whether it's basketball, whether it's soccer, whether it's hockey, it doesn't matter. Those are the athletes that are healthy enough to play and participate at a high level. Mm-hmm. So if you have any old injuries, you want to look at rehabbing those. Even if they feel fine, you want to heal and rehab those in the specific angle and way that you got injured, just to move forward from there. So, Doc, between the injuries of basketball players, what does that look like? Where are the common areas and what are the common injuries that basketball players tend to have?
Yeah, so because of the amount of force that it takes to, these guys are jumping at such a high vertical, so they're coming off of the ground with a tremendous force, and they're landing back on the ground with a tremendous force. And they're not almost always are landing perfectly. They sometimes are landing on one foot versus two. They're also landing maybe on an offset portion of the foot versus inside or outside. And sometimes they're falling right on their butt or back. So you got to make sure that if those injuries are happening, you are giving them the appropriate effort and importance, because like we talked about before in these podcasts, the injury that is going to happen more than likely is the one that you've already had, number one. That's going to be your highest predictor of injury. And then number two, when it is injured, like Doc said, you can't just treat it like it's fine. You have to understand that now that has been altered anatomically, and there's just such a higher chance of it happening. You almost have to now, unfortunately, give it attention more than maybe other parts of the body, because you don't understand what risk you have now. And it sucks to think that you actually have to do that extra effort now. But if you want to stay in this for the long term, you really need to make sure that you're giving your old injuries a sustained effort consistently over time, and you can't give that up anymore. You have to continue to bulletproof those areas, and that's just how that goes. So the areas that we're going to talk on today, number one is ankle injuries. I think one of the most common injuries that we hear of in a basketball player is an Achilles tear. And that one sucks because it's a long, long recovery time. And it is an area of the body that you, as a basketball player, you're going to just constantly put effort and strain into. So when it's torn, and like we said before, now you're at a predisposed risk of injuring it again, you really need to make sure that you bulletproof that area really well. So ankle sprains, ankle injuries, I'm going to touch on all of them first, and then we'll kind of go back into how you might injure one of these areas. The next would be knee injuries. Again, with basketball, there's a lot of changes in direction, jumping again, landing, and that can put a lot of strain on the knees, especially if you have weak ankles or hips. The knee is going to take the brunt of that. So ACL tears is really, really common. I know a lot of, Derrick Rose is one of them. When he tore his ACL, he just never recovered, and had he been able to actually fully bulletproof that knee back into 100%, I bet you he would have had the career similar to Kobe and the likes of those Hall of Famers, because he was an incredible player. So it's unfortunate that these injuries are, can take these kinds of careers elsewhere when you don't have the ability to bulletproof it where you needed to. Hand and wrist injuries, those balls are being sent at high speeds. Some of the power forwards and centers can throw a ball as fast as a NFL quarterback. These guys are big guys, and so they're not just throwing it with one, but they're throwing it with two hands. Kevin Love, they did a sports science where Kevin Love was a power forward for the Minnesota Timberwolves, and he could stand on the one side of the court and literally just, without jumping, literally just toss the ball as quickly as he could to the other side of the court. And his ability to do that without even needing to generate force, he did it all with his upper body. That's how strong these professionals are.
That's crazy.
And so there's a lot of force coming in with these balls. There's a lot of hands coming at you when you are trying to dribble and move about. So eventually there might be contact between each other, dislocations of the hand, fractures. And if you handle the ball more frequently like a guard, that's just going to predispose you to getting that anyway. Foot injuries, again, stress fractures, the small bones in the feet are called metatarsals. Again, the constant coming up and down and landing on the feet can, predispose you if you don't have the proper foot mechanics, good shoe wear, those kinds of things. Plantar fasciitis is super common, again, with players who don't have good foot strength, or just over time, eventually, it just does cause a lot of strain on that portion of the foot, and we'll get into that since that is something that we see a lot too in clinic doc. Back injuries, this is just due to a lot of twisting movements, especially if you're boxing out in the post. If you're a bigger guy and you have to have a heavier weight on, you're already going to be predisposed with weight. Jumping a lot, coming down, putting the stress on the lower portion of the lumbar spine can continue to wear out the back. If you have poor posture, or if you're just not strengthening the parts of the body that will give you the longevity to support the low back, that's going to be crucial too. And then lastly, hip and groin injuries. Again, the sudden movements, changing directions, and what have you. So just jumping into ways that these might happen, and maybe just research to show why this would happen. I'm only going to touch on the main two are going to be ankles and the knees. If we were to jump on all of them, this would be like a 5-hour podcast. Yeah. So the two main ones that I wanted to start with was ankle and with knee. So before I do that, Doc, was there anything you wanted to touch on there before we begin with ankle?
No, I think, just being aware and having the attention on, like Doc said, if you have any past injuries, to start the rehab on a consistent basis, to continue working on those areas, regardless if you feel good or if there's no pain. Again, pain's the last thing to present itself. The first thing you're able to get under control, but unless you create change of the tissues or structure, it's like Doc said, it's going to leave anatomical change moving forward. So that's for individuals at a younger age all the way up to a high professional level playing field as well. So that was really good. Now, ankles.
Ankles, man.
Achilles, man.
So before we get started with ankles, if you haven't watched our series on the body, we dove into, I think it was feet and ankles and hands and elbows, and it does a really great job of just explaining how to get the most out of your warm-up routines, recovery routines when it comes to certain parts of the body. So first and foremost, being able to have 100% capacity of these joints is going to be crucial. So the ankle workspace is number one if we're going to truly build the athlete.
Yes.
So we've talked on ankle workspace before, Doc, but just really quick, what does that look like?
So ankle workspace is moving through the biggest range of motion you possibly can. It's pretty much ankle circles, but if you notice that there's a quick, fast twitching movement as you go through, to go back through that motion, it's then supplying more blood through all the angles and all the tissues locally to help build up and supply and stabilize the ankle joint as well. I know, Doc, there's one other thing I had on here, stretch contraction. So like, let's say, for example, you have a diminished capacity. It's harder for you to dorsiflect, especially for basketball players, for absorbing load and jumping. That's where you would then want to go into a stretch and apply a muscle contraction. And the muscle contraction is one of the only ways that communicate from your body via nervous system down to the tissues. So when you're in a stretching position and communicating via contraction, it's then not going to allow the recoil of the tissues to go back to what it's used to. So it's better use of your time to put a muscle contraction into area of tightness, soreness, or past injury if you have limitations in range of motion. So you do stretch, muscle contraction, circles, and you can build up the tissue capacity from there.
Yeah, yeah. And we'll get to some more specific ankle exercises in a bit here, but that's a big one because, like we were talking about before, when you break down what is needed to rehabilitate an area, the amount of tension and load, it's going to make a difference. And so we'll get to that because I think it's really going to it's going to be more clear on what to do to prevent, but not only, I shouldn't say prevent because you can't really ever prevent, but further decrease your risk of an ankle injury. So first you got to understand the risk factors. So age is going to be one of the biggest ones. Ankle tears are more common in individuals over the age of 30. This again is just as we age, we lose stem cells, we lose our ability to grow, heal, repair. And of course, if you're playing a more competitive sport, you've probably been in the game longer and you've seen that kind of strain and stress put on your body versus someone who's been younger. So, and of course, as you continue to compete, this ankle tendon tissue, they might become less flexible and start to degrade. And that's where bulletproofing is going to be crucial to making sure that you keep the strength and longevity of this tissue as healthy as possible throughout the course of your career. So age is huge. Sex is huge. Like apparently men are more likely to experience tendon tears than women. And this could be due to various factors such as physical activity levels and biomechanics. Again, men tend to have typically higher muscle mass, so just the amount of force we can contribute to that area upon jumping or activity makes more than likely probably a difference. And then lastly, we already talked about this, but if you've had a history of injury, that is going to be one of the bigger predictors of if you're going to ever have an injury again to this ankle. So they say with Achilles, specifically Achilles tendon injuries, surgical fix does lower the chance of re-injury. And I think we briefly talked on weighing the options of surgery in certain parts of the body. With the Achilles, that one, I don't know, Doc, if you have any insight into surgical versus non-surgical, but more than likely, I know you had touched on in a young, very young athlete, if you want to have a longer career, usually reattachment of any tissue is a better course of action. Do you want to just touch on that again?
Yeah, and for the Achilles, especially for basketball players, like you need the recoil, you need the springiness to your feet, and it'll depend on, is it a full tear, like is the whole tendon completely gone? If so, then I would suggest yes, so you can attach it and then start the rehab process. But if it's partial, I would suggest not having surgery. And it depends on, like if you're a high-end level athlete, if you rely on quick movements more so than like you're a center and you still need to have certain attributes like that, but you're able to box out. And is it on the inside, outside? Is it going in a diagonal fashion? If it is, then there's a much higher chance of the tendon completely giving out versus completely horizontal.
Yeah.
But it's dependent. So
Yeah.
if full, then yes. But if not, probably not.
Yeah, there's now going to be a different focus and rehabilitation, really compliant, consistent rehabilitation might get you what you want versus surgical. And I'm always going to be in vote of no surgery unless you have to. So, but yeah, so now this particular isn't going to be a risk factor in a very competitive athlete, but engaging in excessive physical activity without proper conditioning is going to, of course, be a huge predictor of injury. So if you happen to pick up a weekend Bball league and you haven't played in a while, if you aren't properly conditioned or ready for that, there's a high chance you're going to blow that ankle out, man. So, or knee, to be honest. And I've seen that when I was in college. I was in intramurals, intramural team. And now this was right after high school, so I was still very conditioned from high school basketball, which I did every single day of my life. So my fitness, I guess, level was a little different than some of these guys who came off of and hadn't played in a while, or maybe played a different sport, but definitely didn't take care of themselves. And I don't know how many guys in those first 2 weeks blew out their knee, I mean, it was my roommate actually, he blew his knee out, and yeah, he went down quickly. So he had to have the huge cast and had his leg atrophied because he had the cast on for 3 months. And you got to be a little bit more cognizant if you're going to do stuff like that. So
Go into the season with a squad of 20 and you'll have probably about 8 by the
yeah,
time.
exactly. So you got to prepare and just be cautious. You're not an NBA player, man. So don't treat yourself like one if you haven't been preparing for that. And then just biomechanical factors. We'll get into that here actually in a minute. But feet biomechanics, abnormalities like pronation, supination, flat feet, or high arches is going to make a huge difference. What kind of footwear you have is going to make a huge difference. And then just making sure that, the variations of the knee, the hip, the ankle, all those things that we've talked about are something that you got to look at. So getting into feet, which I think a lot of people, they understand, but they don't quite get why this makes a difference and why you should look at this. So if you have high arches, also known as pes cavus, or if you have flat feet, which is called pes planus, those both actually can give you abnormal structure to an increased risk in ankle injury. And so whether it's one or the other, it actually still gives you a high risk of ankle injury if you don't have the appropriate foot support and or ankle strength. So with flat feet, again, this is where the arch is pretty much contacting, if not completely contacting the ground every time that you're walking. So that's going to give you such an increased amount of stress on the heel, on the arch. You have a higher chance of developing plantar fasciitis, prone to actually tearing the plantar fascia, which that is a tricky area to heal, and making sure that when you do injure it, those are times where you have to boot it for 12 months just to sometimes get relief, and that's not a fun one. So just making sure that you understand that. With flat feet, making sure that you are training the appropriate tendons, ligaments for good foot support. This would be posterior tibialis, Achilles, of course, and I'm sure a lot more smaller intricate muscles that make a difference. But if you don't have that kind of training or focus on the foot, when you have flat feet, you're just going to be more prone to tearing the Achilles. And an actually larger chance of tearing your Achilles comes from having high arches. And this is because with the high arch, you have decreased shock absorption because you actually aren't fully touching ground. And there's almost like a little recoil that comes, excessive recoil that comes once you've hit this ground. So this can lead to a higher chance of tearing. And with that, tearing the Achilles, like we've talked about, is going to be one of the worst, if not the worst, injury as a basketball player. So Kevin Durant was one of the more recent ones that now had to sit out, I think, over a year. And we actually talked about this before. And, Doc, with an Achilles tear, a lot of these guys, I think we know and we've heard it takes about a year to get over. So first, I'm curious on your input into this. But number one is, and maybe we can take this in two parts too, but number one, when you are going through that Achilles tendon tear rehab and what that year looks like, we've talked about the tissue. And so the first question that I have is, let's say unfortunately you do end up tearing that Achilles tendon. Why is it important to understand the difference between rest and load? And why is it important to actually lose the habit of training to the injury that you sustained?
Yeah. That goes into what's a lot of people term as load management.
Yeah.
That's where you'll see players, if they have injuries or not, and I'm going to come back to that, is if their body has had old injuries, or if they are playing on an every night basis, like let's say for NBA, for example, when you're younger in your career, you can play most games most of the time. But if you sustain an injury, then the team wants to manage you, because with basketball, it's not completely a team sport. It is, but it relies on larger individuals to take control. That's why NBA players make a whole heck of a lot of money, especially the good ones.
Yeah.
Now, let's take in, for example, this load management. With every injury, it's a mathematical equation to where it's either your tissues give out based on certain position against gravity or against load over time. And if they can't absorb or contraction or action after that, the tissues can yield and give out from there. So it depends on how the training is and all that fun stuff. But in terms of load management, there's two options that you have. It's either you can rest and have the body heal itself, which we know now that it doesn't completely heal itself optimally. There's a lot of scar tissue, fibrous adhesions that get laid down, which then forces compensations above and below the area of injury. Now, so it's either rest, or we can build up the capacity of tissues, which is then specifically causing inputs to the tissue for the healing to accelerate. And we're up against the clock. So with the injury, there's a cascade of things that occur, some of which there's resources of prostaglandins, growth factors, all that stuff. And it comes in stages depending on time. Swelling can occur, bruising can occur, a bunch of different things like that. But when you look to optimally heal an injury, you need probably a mixture of both. For Achilles injuries, which is also why for basketball players, because of the sport of landing, jumping, cutting on a hard surface, it takes a large toll on a small tissue, which has a lot of fibrous adhesions and scar tissue built up with it, which is why injuries continually occur in similar spots when they do occur. Now, ideally, when you want to go into this, for the first few stages, if there's swelling, get the swelling under control. Ideally, boot it, rest, and then I would ideally also have them, depending on if it's complete tear, I wouldn't have them do contractions until after the procedure of when they either sew the tendon together. But even if it's partial tear, light isometric contractions at either 5 to 25%, your maximum muscle contraction intensity, 10 seconds on and off, will help significantly. We can take one from Connor McDavid, go into the hyperbolic chamber, increase oxygen utilization to the tissues for the healing to accelerate as well, and then go back to rest. So it's a mixture of building up the capacity of what the tissues can either absorb or force over time, and increase the intensities, increasing the eccentric work over time. Once you have pain-free range of motion, start loading and lengthening the Achilles. As you go about that, then you can look to add in running, you can look to add in side-to-side movements in a controlled fashion, very nice light. The last thing you want to add in is side-to-side quick movements and explosive movements. You got to make sure we build up the tissues, and it takes months just for the tissues to rebuild. For ligaments, the research is about a year, if not a little bit more. But that's also with some archaic mindset of rehab too. So there's still some discrepancy with that. So I think a combination of rest at the early stages with light muscle contractions, 10 seconds on and off, and then build up the intensity. And then you can add in and start building up the capacity of how you can rebuild specific tissues, especially the tendon, for the Achilles tendon. And with the Achilles tendon, it also works as a pulling lever with the heel, which then attaches to the plantar fascia, which has layers to it. So that's why these two between the plantar fascia and the Achilles works together as one, because one's going to pull the other. Thus, like Doc said, the high arch has a higher tendency for Achilles problems down the road versus a low arch, which doesn't really have the recoil and doesn't have the plantar fascia built up, which then also can put more strain on the Achilles tendon. But it's working both at those at the same time. So like when you're healing an Achilles injury, you also want to do feet rehab and build up the plantar fascia because of the pulling on both north and south pole with that one. But yeah, that's kind of 2 cents on that.
Yeah, and I just want to touch too on, you had mentioned prior to the podcast how Kawhi Leonard actually was rehabilitating his knee or tendinopathy or what have you. But I liked what you said when you said he did a lot more rest than what I think maybe you would have recommended as a practitioner. So
Yeah.
you want to just touch on where rest can start to become an issue and not actually getting to the loading sooner.
Yeah. And I think this goes back to the mindset of with rest, it can help with healing of injuries, but not take into consideration the actual cell type. When an injury occurs, there's damage internally. So like when you get a bruise on your skin, you can actually see the bruising, and then you can see the bruising go away over time for most people, unless there's a condition. But it's going to be the same thing with scar tissue buildup that you maybe can't see on the inside portion of that limb. So when they go into either rest versus building up the tissue capacity, with their mind and their thinking is if they rest at the same time do rehab, rest, rehab, rest, it's going to be really hard to get them back to the fullest capacity, and then to get them back to the twitchy movements, to the jumping, absorbing force for what basketball, the sport, demands of higher end level athletes. But if you're not able to get to that stage, then they're just they're going to rely on rest, and over time the body then compensates. Other injuries can occur. So you have to stress the tissues, and it's being very smart with the intensity in which they either contract the tissues, or the intensity or duration of what rehab stretch exercise they go into is incredibly important. It has to be specific, and depending on where they're at in their rehab, some days there could be setbacks, and that's fine. Definitely don't push back. But once you feel and have certain parameters in place and measurements and markers that you feel comfortable to move to the next level, then slowly progress to that, and slowly load and slowly build on that next level. And then from there, like for example, let's say we want to slowly build on just jumping. Okay, well, first thing what we need to know is absorbing the force. So eccentrically lengthening the tissues. How well can you lengthen over time? Add in load, add in time, add in then speed. And then we can add in the top portion is going into plantar flexion. So dorsiflexion, lengthening the Achilles tendon, and then what we go into is the plantar flexion exploding through, and that can be calf raises, or it can just be slow concentric contractions, or it'd be eccentric contractions of the tibial anterior tissues on the front portion, or contractions on the back portion. Then you want to add in the speed, different areas and directions, and then from there, you can then go into small bounding, small plyometrics, added in strength and speed and explosion. So you're building different properties of movements at the same time as targeting specific tissues that got injured, and you want to make sure you supply the correct input to the tissues around it for less compensation.
Yeah, and remembering that your limbs have all these compartments other than the one you injured.
Yes.
So you're going to have to train the lateral, the anterior, not just the posterior, which was injured, and of course the foot. So yeah, that was awesome. And he had that. We just looked up and found that the tendinopathy that he had in his knee was in, I think, 2018, 2019, and he unfortunately then tore his ACL in 2021.
Compensation.
So, and it's, I mean, you can sit and argue with us all day on what actually caused what, but it's a pattern that's easy to predict, right? When you aren't bulletproofing or preparing yourself to avoid an already injured area, and you put it off and you don't give it the need. And not to say that he didn't, but it's not surprising that something like that happened.
Yep.
And who knows, was it too much rest? Did he not give it the appropriate, consistent, force and load? I don't know. But again, it's interesting how that unfolded, and it sucks.
If you're a professional athlete, be careful who you listen to. Have them roll out a detailed plan of what the stages look like. Ask the question, if there are setbacks, how would you perform, or what route would you take? If they have more rest than rehab, I would be concerned.
Yeah.
If they are not only focusing on the rehab area, but not focusing on other areas as well as you're resting those injured tissues, I would be concerned.
Yeah.
Just a couple small things to pay attention to. I'm not the world expert, but there's certain things that trainers need to know, or other medical practitioners need to know. If you're putting your life, if this is your livelihood, I would search high, low, define it, and make sure that you're going through this process. So this has the least amount of risk for re-injury as possible, especially basketball players.
And if your training doesn't look like Connor McDavid's plan, which if you don't know, we touched on that on the
Please
go back to that, or just look it up. If your rehab plan doesn't look like that, then I think you need to find someone else. So, but yeah, no, that was great. Great job on breaking that down. Lastly, these are just small things that I would hope that I don't have to touch on if you're a professional athlete, but smoking, obesity, chronic diseases or medications can obviously, but actually medication won't be a bad one to touch on. We talk a lot in our clinic about steroid injections, why you maybe should or should not do them. And I know many times in a dire need situation where you have a lot of pain and you have a game you gotta just get back to quickly, or a very more important game is coming up and you're just in a lot of pain. Steroids seem to be a common injection, and why, in my opinion, and I'm sure Doc can attest to this too, is number one, yeah, it takes the pain away, but two, it actually delays healing, and it can actually predispose you to injury down the road. So yes, you're getting that relief short term, but long term, you're setting yourself up for an injury, worse injury, and you're actually stopping the healing from happening at that point in time. So I would not, if ever, use steroids, NSAIDs if I was I did when I was an athlete. And when I injured my knee, maybe I can touch on this too, because I think a lot of athletes do the same thing, but we're young. I'm 18, 17. I had this injury occur to my right knee. My guess is it was a quadriceps strain, and it was pretty severe. Now I popped ibuprofen. The pain itself I could handle, but I did no rehab, none. And I finally, what I would call, got over it, right? But I never gave it the actual importance and assessment that it was due. And now I didn't go on to play collegiate or professional ball, but I bet you there have been times where college athletes or professional athletes had a little tweak and they got past it and they thought of nothing further. And now when I run and when I played, intramurals in college and I dabbled here and there, but it wasn't the same. And I bet you if I still pushed it as if I was professional or I competed every day, I bet you I'd tear something. And that's, where NSAIDs and all those things, yes, in the short term get you where you want, but it's only going to set you up as down the road for something worse to happen.
And I know we've touched on this previously, but I would, and I'm sure Doc can attest to this, I think PRP might be a better route.
Yeah, for sure.
Systemically, locally. And the only time I would almost consider steroid injections would be bursas, Baker cysts. It actually works pretty darn well with that, but just clinical experience on that one. But yeah, Doc, PRP instead of steroids?
For sure.
Instead?
It's going to be 100% yes for me on that. PRP has no side effects. It doesn't cause a breakdown or delay healing, and in fact, it promotes it. Now, you may not get the short-term effects that a steroid can give you, but you're setting yourself up for the long run. And to be honest, if you're going to play professionally, I think the long run should be your focus.
Oh, God.
And yes, there are just times where maybe the window of opportunity to create this, title win, or you're at a point where you need to be there. I guess that's not a point I've never really been in. But what I would say is, if it's going to jeopardize you long term, I'd give it a second thought before you jump. And I'm sure you've done that, right?
Yeah.
I mean, you've been in that level versus myself, but a lot of these, you're going to retire at close to 40. You got 40 to 50 years of your life left, and I don't know. I guess I would think of it differently, but I can't say. Maybe I'm naive to it too. I don't know.
it's like risk versus reward. The risk of it giving out and creating more structural damage is much higher versus the reward. You're able to help your team win, to help with the task, the accomplishment. Obviously, for most high-end athletes, they're going to want to compete, they're going to want to win, but having someone, whether it's your trainer or physician, to know and to talk about the possibilities to give you the best decision at that moment is something else. Like there's a difference between if you're an adolescent or a teenager and you're playing in a championship game and it gives out, and for some odd reason there's a medical staff to help provide some of these awesome resources. For someone younger in age, when you're mid-season or going to a championship game, unless it's your last game ever, I would, even then, I still probably wouldn't mind.
It's tough.
It's situational.
For sure. But again, even in a championship season, if you're young and you have 10 more tries, 10 more years at a try of a champ, I mean, do you want to give up the possibility of having that longevity for, I don't know, like that's this, that's just the things that I would definitely assess as a player. So
absolutely.
Lastly, muscle weakness or imbalance. Again, if you just notice that you don't have good strength in a particular part of the body, especially in the lower limb, just making sure that you're giving that the appropriate attention and time. But Doc, I think we'll get to, actually, no, you had already put it in at the end here, which is great. Is there anything you want to get more in depth on when it comes to ankle training?
Yeah, there's one thing it's kind of along the line of plyometrics, and this is for trying to improve actually skills in the later end of the rehab process. Like you built up the speed, you built up the capacity that your tissues are able to absorb and move in multiple directions, pain-free. There's going to be soreness, of course, but it's a recoil training, and this is a part of the training that can specifically target tendons. Anytime you go through bouts of exercise with quick twitchy movements that are forcing like a sprinting fashion, especially with the wrists and ankles, Achilles, to a certain extent knees as well, that has to be done in a specific way. With research, if you do too many reps of the spring motion, it will have a higher increased chance of injury for whatever tissue that is. Mostly it's going to be the Achilles tendon, plantar fascia, or the patellar tendon. So you want to slowly work on movements from not only a frontal plane, like side to side, diagonal fashion, forward and backwards, but if you're younger, especially 10 below or even teens, you want to limit each session of that of like 300 to 500 reps for each leg, or the increase of injury goes up from there. And that's plyometrics, and probably not everyday basis. You would want to do that maybe once, twice a week as focused training instead of, and that's outside of like shooting basketballs, jumping up and shots and whatnot with
and
that.
This just, like you said, specifically targets the tendon, which again is only going to then improve the longevity of that Achilles and other tissues, tendons that could get injured moving forward. Okay, cool. I guess you talked a little bit about progressive loading too, and then the slow resistance training. Was there something you wanted to touch on there too?
There's a lot of, like we could do a whole hour-long podcast on just the progressive loading, on just the training aspects, but having a general understanding of what it takes to rehab a tissue, go back and listen to that brief session and the compensations above and below, just to give you a general framework, and then you can build up from there. That could be more specific to other areas of the knee and up from there, but it has to be done in a specific way. That is for sure.
And we've talked about this before, but if you guys are interested, we can always do a podcast later. We've talked on this of the actual training and what it looks like. We can spend some time doing that. If you guys are interested, just let us know, comment below. But with that, we can jump into the knee, which is by far the next largest area of injury with basketball players. myself included. So what I should have been doing to get started on the longevity of the joint, Doc, quickly, knee workspace, stretch contractions, what does that look like?
So knee workspace is moving the knee through the biggest range of motion. There's a little bit of rotational work as you go from straight to bent. But what we want to do is not only bend the knee, move the ankle, either inwards, outwards, doesn't matter, straighten as much as possible, come back center in opposite direction, bend as much as possible, both directions. Now in terms of stretch contractions, if you notice, especially for most people turning your foot inwards and then bending, there's going to be a lot of guarding on the hamstring complex. So finding an area, like especially when it's either completely flexed, knee bent, or straight with your ankle turned inwards with a little bit of flexion, and then forcing a contraction of your foot into the ground. This also works well for ankle sprains, for past injuries there. You want to apply a muscle contraction in any area of limitation or lack of movement to build up the tissues, to release tension, to give you more workspace. The more movement your body is capable of, the more potential and the more variability you can have in your repertoire for skill development.
Absolutely.
If we will.
Yeah. The main risk factors that the knee you want to look at to make sure that you have a good idea of what to expect if you are going to get a knee injury, or if you've already had one, obviously, would be the alignment of the knee. So whether it's a valgus or varus deformity, that's already going to predispose you to that type of injury. So varus deformity, having more of an outwards bend to the knee, versus valgus, where you'll have more of a knock knee, or your knees are closer together. And where in relationship to median is where the injury might lie. So for example, varus, if it's outwards, there's going to be more of an outward stress on the knee. So building up the lateral portion of the knee is, Doc, if I'm making sure I'm on this, just let me know. But if not, the valgus is going to be more internal. You want to build up the inside of the knee. And I would say valgus is a little bit more common in most, if not. If you're going to wear out a part of the knee, it's going to be the inside portion of the knee anyway first.
Especially females,
Yeah.
because of naturally wider hips, which there's something called a Q angle, which for the childbirth process, they naturally have wider hips, which then forces the femurs to then go inwards at an angle known as the Q angle, thus putting more stress on the inside portion of the knee and the meniscus.
Yep. Again, we talked pronation and supination of the foot. I don't think we need to touch on that again, but that also can lead to poor biomechanics of the lower limb, which could increase the risk of an ACL tear. And then again, just imbalances. I know we'll get to this in a little bit, but the differences between the quads and the hams is, as far as strength and ratio. Doc, I know, I can't remember if it's 1-to-1 or if one should be a little bit stronger than the other. Do you know what that looks like?
Specifically number-wise, I do not know off the top of my hand, but I know for jumping specifically, you need to have way more quad dominance and tibial anterior strength for spring motion, for the absorption through the patellar tendon, so on the bottom and top portion of your kneecap for the most part.
But does not put the hamstrings any less important, because we'll get to what's called the Nordic protocol, which is a hugely studied rehabilitation for the hamstrings and why that is important to prevent ACL tear. But other anatomical factors, and we'll just touch quickly. Doc did a great job with increased Q angle, which is very important, but a narrow intercondylar notch could also be a reason to why someone might have an increased risk of an ACL tear. That one is kind of tough to see without, I think, MRI. So that one isn't something that I think most just know about themselves, but just, again, extra information for you guys at home. Hormonal factors, female gender. Doc talked about the Q angle, but not only that, females have been shown to have a higher incidence of ACL tears compared to males. I think with not only the Q angle, but just ligament laxity, like we've talked about too, plays a huge difference. Whether or not this is anecdotal, but I was a part of the crew that managed the Minnesota Vixen, a semi-pro football team, and I think within the first 6 weeks of their season, 6 women had torn their ACL. And I don't know if that was just due to them not having good load management into the season, or it was also due to the fact that gender has a huge play in acute angle, all those things. But yeah, obliterated their knees in the first 6 weeks of the season.
Good
So
Lord.
I think from what I experienced, it definitely makes a difference. So now that wasn't basketball, but it definitely has I think it has good translation. So if you have a history of an ACL tear, you're already prone to injuring it again. But what I did find too was you are actually prone to contralaterally tearing the other ACL. And that's just because there is now a heightened risk due to the fact that genetically you might be able to tear the other one, and compensatory factors too, putting more weight onto the other side.
Subconsciously,
Yeah,
for sure.
not making, or just making sure that you don't have that compensatory status. So high risk sports, all of them that involve stopping, cutting, pivoting, just like basketball does, will put extra strain on the knee. And then playing surface. I know this isn't specific for, I'm sure it is specific for knee, but specifically for foot and ankle, they're already looking into changing the turf versus grass on I think both soccer and football too, but
Hopefully.
just that alone has upticked the amount of injuries, and I think they're starting to finally get sick of it, players are, because of just how crucial the playing field is. Doc, did you play on turf too, along with grass? What did you notice?
And this was for soccer or football, and this is the turf was definitely harder to slide on. Obviously, there's less give, but it also, for most of my teammates throughout multiple sessions and games, there was a higher incidence of ankle injuries. Just there's less give on the ground. And then force, especially with cutting movements, the tissues gave out much more from there. So like what Doc's saying, with other sports, especially football, with cutting movements, if they play on grass, there is give, which then allows for absorption much easier. But with basketball, like there's limitations. Can't do too much.
Yeah, I don't know what. I wouldn't say there's many differences in surfaces. If anything, it would just be making sure you have good grip and proper shoe wear to inhibit sliding and other aberrant motions that might happen. So age absolutely can make it increase risk once you obviously get to a certain age. Tendons tend to wear out, those kinds of things. But adolescents do tend to also have an increased risk of tear, especially if they're playing heavily in those kinds of things. It said particularly during growth spurts. And I can understand that. You have less neuromuscular control. You're kind of understanding this new coordination every time you gain inches. And that is just, again, making sure that you are properly not only training physically, but neuromuscular, skill-wise, talent, coordination. All those things are going to have a play in understanding how they move their bodies as they continue to grow. Doc, anything on that?
Tissues are lengthening. And really good point, no one really talks about the neural input to the area as everything's growing, expanding. There's a whole hormonal, metabolic component to that as well. But yeah, it's anytime you go through a change as significant as a growth spurt, there's a lot of change going throughout all the systems of the body. So you have to be prepared at that age range. For females, it's going to be younger, between anywhere from 10 to 15, 10 to 13 years old. Males could be as young as 13 to 18, 19 years old. So
just understanding what that looks like. And of course, understanding that if an injury were to happen, give it the proper demand and importance.
Oh, God, yes.
Because they are young and they'll get over the pain probably quite quickly. But if you do plan on, and if you feel they plan on continuing this sport long after, then it's going to take that proper time and repair just to make sure that they are set up for future. I have a couple things that I want to touch on to end. Doc, you can always add in after or just whenever you want. But the two things that I found to be interesting, when neuromuscular training was actually put into high level, study was done on female athletes, but I think it was a good study because we talked about just how much risk they are when talking about ACL injury. But when neuromuscular training was actually applied to their daily routine, ACL injury decreased by 50%. And I think it just shows, again, why knowing where your body is in space, understanding that coordination is just as important as physical structure. Anything with that, Doc?
No, that's perfect. There's different ways that you can apply neuromuscular training, whether it's balance work, whether it's banded recoil work. And this is something that, in order to do this, not only for the neuromuscular training, but for also tissue maintenance. Like if you find, or if you have an exercise band for that matter, you put it around your knee and you go from double leg, like let's say you're dribbling a ball and you try to go through different moves, that slight little bit of motion will affect how the communication is of not only your hands moving the ball, but also cutting movements to shake the defender off, to force them to change so you can go around or pass the ball or create a sequence of events to make points, if we will. But if you have, with this training, a band pulling from multiple, through multiple outwards, inwards, in front of you, backwards, not only at the knee joint, but below and above. This will help better facilitate absorbing force. So like when you go through movements, attaching a band and go through a set of movements as you're dribbling the ball, open up, go into certain rotations to allow absorption of force for small tissues which have a tendency to give out, thus then can create injuries or increase injuries of ACL tears from there. But
and also what he was saying, which he didn't bring up, was the multi-rehab, which we've talked on I don't know how many times now. And again, you'd think of the sport of basketball as maybe having more linear movements, a few directional, but to train that way too, and to specifically train that way, not just by body movements and maybe agility work, but actually giving some resistance to it and being specific with isometric and eccentric movements, those kinds of things too. It's going to make a difference in the long run.
Oh, absolutely.
Yeah.
Now, as we're just targeting on those tissues, the muscles and tissues that are so neglected, which we touched on a little bit briefly, are the hamstrings. And those, quite frankly, you may not know this, but there's certain parts of the hamstrings that come down below and attach to the front of the knee, and also the outside, inside and outside portion. So Doc, what's a good protocol that works to help build up those tissues to help also with ACL injuries?
You're right, and this is just one way, but this one has been heavily studied, and it's called the Nordic protocol. And how it works is one way it works is you are on your knees and you have an individual either hold your ankles behind you, or you can find a way to fasten yourself. But it's then an eccentric type of action. So you are holding yourself up and then trying to very slowly fall down onto your belly. But as you do that, you want to try and hold yourself up as long as you can before you fall. And some individuals are incredible at that. They can actually maintain tension the whole time before they actually fall to the ground. Now, getting started, you might not be able to do this fully. You might have to start at about so many degrees and then have to fall because the strength isn't there yet. But this evidence showed its ability to prevent ACL, by far one of the best ways, just being able to do this one specific movement. It's a great way to rehabilitate the injury if you ever did sustain a hamstring injury.
Yeah, when going into this, either using like a spongy pad that has give, or a towel rolled up multiple times underneath both the knees. So when you go into straighten your leg, it then allows a little bit better glide of the kneecap on top of the femur. And then you can also build off of this Nordic protocol by bringing your feet outwards or inwards to work on different angles and parts of the knee as well. So just a small.
Yeah, you can do that maybe singular too, or by itself, right?
Ooh, that's tough.
The unilateral one, for sure.
Yeah.
Who knows? There's just definitely such a demand to that area if you're going to decrease your chance of a specifically ACL, which is going to be by far the most common. But Not only that, I'm sure it does improve your ability to withstand a meniscus injury, MCL, LCL, other ligaments, and tissue as well.
Yeah. Now, Doc and I were discussing, a couple days ago about the LeBron MJ discussion of who's the best. We'll probably leave that at bay, but I do want to go into a few things. Doc did an awesome in-depth analysis of LeBron's routine, and obviously LeBron James, he's one athlete that is a specimen. He's lasted a long time in his career, so much so that this is the first time, I think, in history, if I remember right, that there's a possibility to play with his son on the same team. And I don't know if that's ever been done in any of the other sports. I think hockey maybe once, but I
don't know
rare.
if anyone's played together. I don't know. I'd have to look that up.
But yeah, Doc, I guess LeBron's routine.
Yes, and I have a couple today that I'm going to be excited to bring to you. One is LeBron, one is Kobe, which two of the greats. I mean, we're talking top-level athletes who have incredibly lengthy, impressive, successful careers. And with LeBron, at the time of the articles, it had come out. This was a while ago, so I bet you now that amount has increased to similar to Ronaldo's price, which was last podcast, 1.5. This one was his. He spends about $1 million, but I bet you it's similar to 1.5 or 2. I mean, it's got to be so extensive. So I'm going to do with LeBron's routine just a general overview of what all of his routine as far as diet and exercise and recovery looks like. And then with Kobe, I'm going to actually dive into what his training day-to-day looked like. So with LeBron, first and foremost, he has a nutritionist and a couple of personal chefs. He has all of his meals tailored to his needs. He focuses on, obviously, a very balanced diet, and I think emphasizing organic whole foods, but he avoids, obviously, processed foods and sugar. I'm sure his vitamin routine is extensive, making sure he takes the appropriate amount of protein, amino acids to support, recovery and performance. But getting into exercise, there were 4 or 5 things specific that it had hit on that he does, and this was a kind of a conglomeration of about 5 to 10 articles. So if you want the specifics of what that looks like, again, we can show that to you. But just as an overview, the strength protocol was using a specific personal trainer. I'm sure every day he's got his own or he pays, but weightlifting, resistance training, functional movements to make sure that it not only does he enhance muscle strength, but endurance of those muscles. He does free weights, machines, resistance bands, but cardiovascularly, he actually does running, biking, and swimming. I know swimming is got to be one of the best things for you. It works almost every muscle in your body. Super great workout. I think it's one of the best in my opinion. And then
low impact,
high intensity interval training, again, to improve cardiovascular fitness and stamina. It is shown HIIT actually does better to improve cardiovascular metrics than just standard long duration running. So that's going to be important, especially with the kind of activity that he does with basketball. Does involve more bursts, sprint type energy versus needing to maybe run at a lower pace for a long distance of time too. So secondly, with that more basketball specific training, I'm sure he shoots thousands of balls a day. Works with coaches to refine his techniques and stay sharp on the court. Flexibility and mobility, he does yoga, he does Pilates, and I know that he does a lot of myofascial release techniques. He has his chiropractors, he's got multiple practitioners on the side that I know he sees. And then lastly, recovery. Just like Ronaldo, he's got cryotherapy, he does his own oxygen hyperbaric chamber at home. I think he has 4 or 6 regular massage therapists at hand every day to, multiple team of massage therapists is what it said in the article. He does compression therapy each day. He's got a chiropractor on staff that he loves, which was really cool to see. And then, like always, prioritizes sleep, which he shoots for about 9 hours a night and does advanced sleep tracking to monitor quality. So I think also the last thing that I thought was super cool was he has muscle simulators and anti-gravity treadmills. that he finds to be more helpful. And Doc, the anti-gravity treadmill, I'm not familiar with, but do you know what that is?
Oh yeah, it's a treadmill that is connected at your waist to diminish the load on the lower body. This helps for rehabbing injuries. This also helps for building up certain tissues and the blood that goes to the tissues for the healing and recovery process. But yeah, it's something that would make sense for him doing longer periods of time on a firm surface. The less pressure you can have on the joints and those tissues, but still to deliver blood flow and the neural connection from brain to the body makes a lot of sense for him too.
So almost inhibiting that force on the joints, but also making sure that he moves that area too.
Yeah, and if he was smart, and I'd almost anticipate he does do this, but I don't know 100% for sure. Not only running forwards, but also, and if you guys have seen these treadmills, it's connected at the waist, so there's not much movement. I would also look to see if he can move in a side-to-side fashion, and also backwards as well. So you can build up the different tissues throughout all of his legs, lower body, multiple planes. But
awesome.
Dude,
I love that you hit on that.
I love that.
Lastly, this was a theoretical breakdown of what he actually might spend on his $1 million investment into his body, which I thought would be interesting to see. We can throw it up there for you. But personal chef and nutritionist is probably a couple $100,000 for the year. Supplements and organic food is probably $100,000. He has personal trainers and coaches with a couple $100,000. The cryotherapy and the hyperbaric chamber is around the $100,000. Chiropractic and massage is $100,000. Advanced recovery equipment is about $150,000, maybe $200,000. He's got a full medical team, which it says $100,000. I bet you that's way more. And then, of course, alternative therapies and recovery is another $100,000. So, man, what a breakdown of making sure that he's, what is he, in his 40s now, right?
I think so.
Yeah. And I think it said he is now the oldest active player in the league. And to still be killing it at his age on such a demanding sport. I mean, that's where I think he can have at least that portion of the argument of the great, because no one's ever done it. So there you go. At least he's got that part of the argument. But I put in there what his balance of fat, protein, carbs looks like, breakfast, lunch, snacks, hydration. Yeah, we can throw it up there. I even put what an example of dieting or day of consumption of food looks like. So, but yeah, that came from about 10 different articles. So that alone is just by itself incredibly impressive. That's
awesome.
I wish I had that kind of money to do that for myself. That'd be,
cool,
freaking awesome. So yeah, moving on to now Kobe. This is where it gets a little more fun. This is where we broke down really what a full day of a workout looks like for Kobe. And this came from a few different articles. So we'll kind of take this in bunches. The first one is what his time schedule looked like from start to finish. And then we'll actually break down what the workout routine looked like and some other training points that he did. So to get started, Kobe wakes up at 4 in the morning and he starts by meditating right away, 10 to 15 minutes. And Kobe, for what I read, he read a lot on meditating and he read a lot on mental health. And I think he even studied with some of the higher experts on that kind of thing. And he said that it helped set him up for the rest of the day. It provided an anchor and it helped him control and dictate the day instead of chasing it, which I think is a really beautiful thing. He not only said it was mentally inspiring, but physically he found meditating to help him too. So 4 a.m. he got up and he went right to work. Next up, he was on the track and he did what was called 6-6-6 workout. And so working out 6 hours a day, 6 days a week for 6 months a year. And 6 hours was divided between 2 hours of basketball, 2 hours of weightlifting, and 2 hours of track. And then the track itself was a high intensity type of training. He sprinted, jogged, walked, and he did that at 100, 200, and 400 yard intervals every day. And so I think that's a cool way to break it down, because I would almost see that as load management, Doc, right? Is that kind of what you would look at there?
Yeah, every single day, that would be tough. I mean, maybe every single day, maybe not. I'm not sure. And it depends on in season, out of season. Is he at home? Is he not? But
And the intensity to which it
that's,
is maybe he
yeah,
varied too.
yeah. The mental fortitude that he had is unbelievable with everything.
So after his workout, he had breakfast, which this stated it was typically eggs, oatmeal, fruits, nuts, some milk. And he was very particular about his diet. He avoided coffee, alcohol, fast foods, and baked goods, which doesn't surprise me, obviously, with a high level athlete like himself. Then 10 o'clock came basketball. So he started out shooting around 700 to 1,000 shots a day. Neuromuscularly, this makes sense, right? Just rebuilding that brain to body connection. He did defensive slides, he did dribbling and shooting, and then making sure he ended on making at least 10 shots in a row from each spot on the court before moving on. So again, it would add up to about 700 to 1,000 shots just to make sure that it was dial in. And that's freaking dedication right there.
Impressive.
After B-ball, it was lunch, which it stated was a vegetable salad with some cabbage, broccoli, along with some fish and olive oil. And then, again, always cutting out sugar and opting for lean meat and vegetables. Then he did after lunch workout. And it was a couple hours working. Oh, excuse me. This was after lunch. He did mental work. So I don't know if you guys know this, but Kobe wrote many books, creative projects. He was a writer, investor, storyteller, entrepreneur, and a pioneer for inspiring others. I know he made a crap ton of money on body armor. That was one of his biggest, I think, investments, if I'm not mistaken, at least one of them, which is that sport drink. And I think he was one of the first that invested into it, and I think he ended up making hundreds of millions on it. I mean, it was very impressive. After that, we did weightlifting, 3 p.m. He did a blend of not only traditional but Olympic style lifting. Doc, with a kind of athlete that Kobe was that something that you found to be interesting, or was that something that maybe you would change up?
No, it depends on the intensity brought in to it, but with Olympic lifting, it's more of a full body approach for most of the lifts, especially like hang cleans or overhead presses, which makes sense for building up tissues for a full body approach, for load management on his overall system. It's smart that he goes through a workout in the morning, rest, recovery, hydrate, nutrition, and then goes back and does something a little different. I mean, theoretically, you could possibly do in off season a similar workout for similar tissues you want to target twice a day, or if you want to do this at night or in the later half of the day, and then the next day earlier on lighter of the same or similar workout, similar tissues, which can help build up tissues as well. But it's really smart for him to go that route. So I have no qualms.
Yeah.
That's cool.
Focus was building strength and elasticity without gaining too much mass, and then using lower weights, high rep for that. Dinner time came quinoa and lean meat is what it stated in the articles. He also spent a lot of time with his family. I know his kids were everything, and he loved coaching them. I think a lot of them played sports, and unfortunately, rest in peace to Kobe and his daughter and the other individuals in the helicopter crash. But that was very, very important for him. And then lastly, he ended the night with reading and writing. Again, this is where it put in that he published several books. One of them was, I think one or two of them were New York Times bestsellers, just emphasizing the importance of training not only the body, but the mind. And then he ended with reflection, which he said was the biggest lesson of his routine, was striving to be the best version of oneself, regardless of the field. And I think if there was one thing that everyone knew about Kobe, and it was even trademarked, was the Mamba mentality. And I think his work ethic can inspire anyone as it comes to just what that man had devoted and dedicated to his craft and just what he wanted out of life as a competitor and an athlete. I don't think there was anyone like him. I think he was of one.
And even with the Mamba mentality, I didn't get a chance still have not yet read that book, but I've seen videos and learned off that mentality. Even based on the reflection, that's where I even took a page out of his book on reflecting on past either situations, activities, or at the end of the day on what could have been better, what I should have done, or just even reflections on how the day has went to. And then to then mentally set and then go into the next day is so important. But yeah, God, he was so mentally strong.
He was.
Everything.
And I remember there was a video article on, I can't remember which player that was a rookie and had just came onto the team, and he was so driven to impress his teammates and specifically Kobe. And so he was like, you know what? I'm going to wake up early and I'm going to get to that gym and I'm going to be there before everyone else. And I think he said he woke up at like 4 a.m. and he got to the gym and he didn't think anyone was there. And he got to that gym at 4 a.m. and Kobe, he'd heard a ball dribbling and it was Kobe, and Kobe was in the gym, and he went up to Kobe and he was dripping sweat. I mean, just dripping sweat. And I can only imagine Kobe got up at 3 and was there earlier. And all I think Kobe said to him was, you want to be the best, you got to get here earlier. And I think he walked away. And then he also said that Kobe would not talk to younger individuals. They had to earn that because it just came to a point of respect and ambition and goals. And Kobe was only going to share that with those that he felt were worth his time. And I mean, that is just cutthroat, die hard, Mamba mentality. It's so freaking impressive.
That's crazy.
So the breakdown of his workout routine, this was again in the articles. Monday and Thursday was upper body, which consisted of bench, lat pull down, incline press, military press, bicep curls, and iso hold push-ups. We'll put this all up here for you guys. Tuesday, Friday was Olympic lifts, so this is a little bit more heavy and different type of style, but stiff-legged deadlifts, Romanian deadlifts, clean pulls, dumbbell raises, bar dips, triceps press downs. Wednesday and Saturday was lower body, so we worked, back squat, front squat, curls, extensions of the legs, calf raises, and ab crunches. Doc, anything that you see there that
was good.
Interests you?
I think if he was still around today, God, obviously he wouldn't be playing, but I think there would be certain things that he would switch up if he was playing, or when looking back and reflecting for himself, that he would change up if he knew the literature, what was out there. Like, he had an obsession to optimize every single part of his day, schedule, and everything he did.
Yeah.
And that's the part that I absolutely admire, everything about who he was and what he's about. So I think, there's certain things that I would maybe look to train or change up a little bit, but in terms of the breakdown, on the progression, the periodization.
Yeah, we talked about this last podcast, eye training. I think this one is involved in a lot of high-level athletes that people don't understand. And it comes down to, I think Doc did a great job of diving into that last podcast, if you want to jump back and take a look at it. But the understanding of scenarios, breaking down where to find open spaces, what patterns people are weak in, are they weaker going to the left or the right? Where can you take the defender to get past them? Again, it comes with scouting. You talked about that too. And just that peripheral vision training to really make sure that you can pick out that in-game scenario and be ready for it and predict it. And eye muscles and the coordination and the eye tracking is only going to benefit you. And I think it's something that people don't really understand as an edge to your game when you're at that kind of level of competition. He talked a lot about release points with certain shots. He measured and did trajectory of the loft of his shot, the arch of his shot. He practiced harder shots or different planes of shots, like fadeaways and side-leaning shots. Again, he was prepared for the more difficult shots that he was going to come up against, because in the NBA, you don't always just get that easy jumper. I mean, you got to create the shot sometimes, and he was an absolute expert at that.
Yes.
He could create a shot from anywhere, and he was by far one of the best, if not the best, at doing that. Dribbling skills, obviously he dribbled with both hands. He worked on dribbling harder and working at that highest intensity to make sure that he could dribble and handle the ball at the hardest capacity when he had to, obviously on a breakaway, or making sure that he could manipulate the upcoming direction and speed if the tempo picked up in the game. He also practiced flinching while dribbling. So if there was ever a time where someone was in his bubble and it ended up causing an aberrant motion and his hand came off the ball, how to get back on the ball and get back to control of the ball. And then just, again, dribbling at different angles with two-legged stance versus one-legged stance. And then lastly, controlling exhale breathing while playing the entire game, which I think you had talked on too, of just how important it is to keep your breath, heart rate low. And it's makes sense that he would do that. Like, of course he knew how to do that, right? Like 100%. it just makes a lot of sense. That's super cool. Lastly, it says protect the ball. What side are the defenders on? How to shield the ball while moving different directions. And then the body between the ball and defenders, or ball around your body. What does that look like and how to prepare for it? So you want to talk about an absolute fully to the max training routine that hit everything as far as a high-level athlete. Kobe did it. No surprise there. Man. Doc, anything you want to say on that?
That's crazy cool. Like when you go into, like, especially for training and bulletproofing the body, physically, you definitely want to make sure, like we've said previously at the beginning of the podcast, build the tissues that you've injured. Then there's the diet nutrition component. There's the mental component. And then I like what Doc said with the eye training and just even manipulating the defender. I was actually watching this, and he was talking and teaching, I think it was a Lakers. This was, a few years back. This was definitely before, obviously, the accident. But he started touching on topics of, you read the defenders and their tendencies, and you see how well you can optimize or how well you can predict what they're going to do. Also, anytime you're trying to go around the opponent, you want to make sure they're off balance and then switch up how you go about it. So if there's one movement that they react, that they twitch, don't go back to that same movement, but try that. It's almost like a mental chess game, and how he said it, to where if you went that way, you know that the defender knows you went that way. Now, do you have other tools in your toolbox? Can you get the defender offset to go the opposite way? Can you do a fake? Can you switch up, create hesitations? Like, all that is all strategy. All that can be learned probably on YouTube to a certain extent. And then going through and practicing those and creating variability. The other part that I really liked that he brought up that I never thought about was when he goes up for a shot, whether that's a step into, and this is actually a little bit that I learned from Steph Curry as well. When you go up into different various shots, if your head, eyes are off center, opposed and compared to your arms, the ball has an incredibly high tendency to follow where your eyes or your head is at. So if you can come back to center, or if you're in the air and your head comes back to center with where your hands are, the shots go smoothly every single time. Some of that has to be practiced, but sure, if you align your hands and your head with the shot in various movements, higher likelihood of shots being made.
Yep.
It's fascinating.
And to end, I remember you just brought up a thought. I guess he was one of the best at legit in-game analysis. He would start off maybe not on the page he wanted, and his ability to change his game coming back into the second, third, fourth quarter after. I mean, there are so many times where, I think this was Nick Young was talking about this, or I can't remember who it was, but basically Kobe had allowed Schumpeter to have a lot of points at a certain early portion of the game, and he thought he was just killing Kobe. And Kobe wasn't doing the greatest offensively either, and so I think third quarter came, and he goes, and Kobe literally looked him in the eyes and he goes, "You don't even know what's coming at you yet." And third quarter came out, and I think Kobe put up like 43 points in the second half, and Amon put up like 2 or 3. And it just goes to show, I bet you, just the amount of IQ to the game. analyzing everything and taking all that in and knowing what to do with it. Data extraction, remembering everything. They say LeBron has a photographic memory and he can remember every play he's ever been a part of. And there was a finals game that they talked on where they needed to do an inbound play to end the game. And LeBron said, he goes, I know what they're going to do. I already seen their setup. We did this 3 years ago with this one team. We're going to run this play. And they improvised it and they shot it and won the game. I think he hit the shot. For him to have that recall and that just analysis, it just goes to show the impressiveness of their cognitive IQ of that game and recall. I mean, it's otherworldly. It's otherworldly.
Yes. If you go back, if you want to even try to absorb what their mental process is, I'd suggest listening to the podcast of, was it JJ Redick and LeBron?
Okay.
They went over like different gameplay scenarios, almost exactly what you said, and you could see what LeBron's thinking with certain questions that JJ Redick has brought up on what he would do, other situations that can come up from there. And you can see like he went so in depth in terms of the analysis of the defender, the tendencies of the time in the game, who was shooting well for his team at that point, and how could they best set that person up. And this was not just one game, but multiple games. So I'd suggest if you have time, definitely go and look at that. But try to find other videos of the in-game scenario strategies that high-end level athletes have to see how they process certain situations, and then put yourself into those situations in terms of mental training and also mental and physical training.
Yeah. And looking
crazy.
back, I mean, I wish that I knew how to think like that when I was playing, because it wasn't that I wasn't working hard. It's that I just didn't know how to work that hard. And I wish that I had a coach or a trainer or someone who knew how to get you to that next step, because I think I would have loved that, and I think I would have thrived had I had that actual dedication and experience to know what to get to. You know, if you've never built a bridge before, it'd be nice to have someone who knows how to build a bridge on your side.
True.
And that's really the most simple way that I could put it. So is there anything else, Doc, you want to end on? Perfect.
Yeah,
all right.
that's good.
Well, we appreciate this so much, guys. I hope you enjoyed the podcast. We'll be looking forward to coming up on more Bulletproof and the Athlete podcast coming up. So look forward to that. Until next time, please like, share, and subscribe. We appreciate every single one of you guys. Thank you so much. Until next time, Doc.
Woo!
We'll see you.
Yes, sir.
Disclaimer: the content provided in this health podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided in this podcast is solely at your own risk. The creators and hosts of this podcast are not responsible for any actions or decisions you may take based on the information presented.
Thanks for joining us on The Functional Code. For more evidence-based health insights, subscribe, rate and review wherever you get your podcasts. Remember, your journey to a healthier you begins with understanding the Functional Code. Until next time, stay well, stay informed, and embrace the science of living well.